Hi, good afternoon. My name is Dr. Gauri Kulkarni, and I head the medical operations at MediBuddy. Today, we'll be talking about everything around the COVID-19 vaccine. I know that a lot of you are now getting vaccinated, and we have a lot of ifs and buts and questions and queries about what is the right vaccine to take, should we take it at all, or what are the possible side effects, what if something happens. So there are a lot of confusion. People are going and asking and trying to search for the right information around this. And it's important that we talk about vaccination so that we understand why we should take it and how is it that vaccinations are going to help us in the long run. Okay, so let's go ahead and talk more about the current vaccines which are available. Let us also, come up and ask questions. If you have anything that you would want to know regarding vaccination itself, do bring up your questions, and I will try my best to clarify all your doubts. So let's begin, right? So vaccinations have been there. Immunization schedule. Children have been vaccinated for a long time. All of you in your childhood were given vaccinations against preventable diseases, right? So vaccination is not something which is a new thing around, right? We all understand. What do we mean by immunizing someone is that we are trying to ensure that we protect the person against a specific vaccine preventable disease. Okay, so there are a lot of these diseases which we have been able to ensure that we have eradicated as well. So things like smallpox, to a large extent, polio now has been eradicated. Measles is another one which is people are trying to get to a place where we can eradicate it. So there are a lot of these diseases which have been eradicated, right? So vaccines are definitely something which help us in the long run to prevent the extent of the consequences of a disease that can happen, specifically deaths or mortality, right? So that is important for all of us to understand. Now, in the light of COVID-19 infections, there have been vaccines which have been developed in the last year or so, which have been used at a large scale all over the world to ensure that we protect ourselves from the illness, right? Now, of course, there are many vaccines, which have come, right, in the foreign countries, but let us talk about what is there in India, right? Now, currently, the vaccines which are available in India, one is Covishield, another one is Covaxin, and of course, there is the third vaccine, which is the Sputnik 5, which has now come into India. There are, in the next 2 months, we also expect other vaccines also to come into the commercial market. Things like Pfizer and Moderna are supposed to be here. The nasal vaccine is getting, undergoing trials. So there are a lot of trials going on, and we hope that there'll be more and more vaccines available against the COVID-19 infection, right? But today, let us restrict our conversation around the Covishield and the Covaxin, which are the two most commonly available vaccines in India, right? Now, we all know this because vaccines have been now available in India for almost now 5-6 months now, right? From the time that initially it was available for the frontline workers, and then it was opened up for the older individuals about 65 years of age, then to about 45, and now it is open for everyone who is above the age of 18, right? So the Covishield vaccine is the one which was developed by the Oxford AstraZeneca company and then manufactured in India by the Serum Institute of India, right? And the Covaxin is the Bharat Biotech vaccine, which has been indigenously produced here, right? So there are two vaccines which are available. Now, as with many other childhood vaccinations, if you know, these vaccines also need to be given in not a single but a double dose. That is, 2 doses are required for both these vaccines. Now, because these vaccines are made in a different way, right? The Covaxin is a killed attenuated vaccine, which means a whole virus vaccine, versus the Covishield, which is more a vector-based mRNA, spike protein-based virus, a vaccination. It is important for us to understand that these two vaccines have been produced in a different way. though the end result is the same. The end result is going to be that there is enough antibodies that will be formed, and we will have, we can generate our own immune response enough for us to fight the infection if it comes to us, right? So we have to understand this, that these two are made in different ways, but the end result is the same. Okay. Now, because these two are made in different ways, we cannot mix and match them at this point in time. So if we have taken the first dose of Covishield, then we will have to take the second or the booster dose also of Covishield. Similarly, if we have taken Covaxin as the first dose, then the second dose will also have to be Covaxin itself. Please remember this. This is extremely important so that you know which vaccine you are taking. Okay. Now, now the next question arises as to, how is this vaccination given, right? And typically, this is an intramuscular injection, right? It's an injectable form of vaccine. So they give the injection on your arm, okay? And this is, as I said, in 2 doses. Now, when is it given? If the first dose is given today, then the timelines are different for both the different brands, right? So if you are taking Covaxin, then you will have to take the second dose after 4 to 6 weeks. If you're taking Covishield, then it has to be 12 to 16 weeks from the first dose, right? So the timelines have been made based on the efficacy and the amount of time that is required to generate the immune response, okay? So that is how the 2 doses have been, the timeline for the second dose has been brought up, okay? Now, naturally, the way the vaccines basically work is that when the first shot is given, there are certain memory cells, right, which are formed. Like our immune system is able to understand that I need to fight against some foreign body which is there inside me. So a memory cell or memory fighter cell is formed to kind of understand what is this specific foreign germ which is there inside. The second dose, when it is given, there's a full-blown immune response which happens, wherein enough antibodies are then prepared so that we are ready to fight the infection if it ever comes to us. All right. So that is how the vaccinations work. Now, it is important for all of us to understand that vaccinations definitely help in many ways, right? Now, but does it mean that if I am completely vaccinated, I don't need to follow any COVID appropriate behavior? I think that is a wrong thing to understand. That's a wrong thing to presume. Okay. So even if you have been vaccinated and vaccinated completely, it is important that you continue to follow COVID appropriate behavior. Okay. Like wearing a mask, ensuring that there is physical distancing, sanitizing your hand, cleaning your hands, so on and so forth. So it's important that we follow COVID appropriate behavior at all times. What does vaccination help us with? Vaccinations over a period of time will ensure that our morbidity or our extent of illness or the severity of illness will be very, very low. People, vulnerable groups who would otherwise would succumb to the illness, which means they may have died because of it. The mortality because of the illness reduces. Naturally, the strain on the healthcare system reduces because there'll be less, less hospitalizations and less, of course, the burden of illness would be less, right? So that is where it helps. And of course, it breaks the chain of transmissions. The number of people who are able to quickly, spread the infection, that would be lesser. And over a period of time, a lot more people would have antibodies develop so that there is enough herd immunity that is generated. Is the reason why we should all get vaccinated. Now, of course, a lot of people have questions about, can I get vaccinated if I have so and so health condition? If you are above the age of 18, you can get vaccinated. All right. If you suffer from any chronic disease, when I say chronic disease, it could mean high sugars or diabetes, high blood pressure or hypertension, or if you have any chronic heart disease, chronic kidney disease, chronic liver ailments, if you have, say, thyroid issues, if you have any chronic lung issues, such as, say, asthma, COPD, any interstitial lung disease, if you have any long-term illnesses, such as autoimmune diseases, or you are on long-term immunosuppressive therapy, or even patients who suffer from cancer or are undergoing cancer treatment, or people who have, who have any other kind of chronic diseases, most of them can actually go ahead and get themselves vaccinated. If you, however, have a very history of a very severe hypersensitivity reaction, which means that you reacted to a particular drug or a particular substance extremely in a severe manner, where there was, you had to be hospitalized because of the reaction towards a specific drug or a substance, then it's a good idea that you talk to your doctor to understand if you are eligible to get yourself vaccinated. If you're suffering from any coagulation disorders also, it is important that you may want to avoid the vaccine and talk to your hematologist or your treating physician, who will explain to you why or maybe why not you can take the vaccine. So please go ahead and consult your doctor if you have severe hypersensitivity reactions or coagulation disorders. Now, if you are definitely a breastfeeding mother or a new mother, you can go ahead and get yourself vaccinated. The latest directive from the government says that lactating mothers can safely get themselves vaccinated. The little one will not be affected. On the contrary, antibodies which the mother will develop would hopefully be given to the child and thus protect the baby as well. So it is absolutely all right for lactating mothers to go ahead and get vaccinated. If you are planning for a family, then I think it is important that if you can wait for a few months and get yourself vaccinated first and then plan ahead for family, that will be great. However, if you're already undergoing, say, infertility treatments, I still suggest that you should go and get yourself vaccinated. It will only help you in the long run. For pregnant women, currently there is no specific directive from the government. They still say that it is best to avoid because there are not enough trials done for the vaccines available in India. However, the other vaccines which have been used, especially in the US, such as Pfizer and Moderna, have been used in pregnant women as well. But those vaccines are yet not available in India. But it is a good idea because what has been seen is that over a long period of time, if there is a high prevalence of COVID, then there has been some justification to using the vaccine. So my advice to you would be, if you're pregnant, then do talk to your gynecologist, because there is definitely, the benefit of taking, in certain situations, the benefit of taking the vaccine may override the risk involved. However, it has to be a very conscious decision that the mother, the expected mother makes along with her treating gynecologist. So do talk to your gynecologist if you're pregnant, and if you can go ahead and take the vaccine. However, perspective against all this. So I hope that kind of helps you to make some decisions as to when you can get vaccinated or what you can do and in what scenarios you can or cannot get vaccinated, right? So it's important that you remember these points and then go ahead and book your schedule for getting yourself vaccinated. Now, it's important to know what you should be doing, right, on the day of vaccine. A lot of people do ask this, my schedule is tomorrow. Should I take my medicine? Should I not take my medicine? What should I do? So I think it's important for us to be prepared, right? We need to know when I'm going to get vaccinated, right? So you have your schedule, you know where you have to go. So first and foremost thing, I think important thing that we need to remember is that always be on time for your vaccine schedule, right? Because it does take time. You will have to wait initially, you'll have to get yourself registered, post the vaccine is done, you will have to most probably sit there for about 30 to 40 minutes before you can go back home. So the whole process does take about 1.5 hours, right? We have to understand this. And hence it's important that on the day of vaccine, you arrive at your vaccination location well in time. Don't be late. Okay. Second is, ensure that you do not go to the place empty stomach. Eat your regular, your breakfast or the whatever meal you're supposed to eat, and go on a full stomach so that you do not have any fainting or you feel unwell after taking the vaccine. So ensure that you eat well, drink water, maybe carry a small snack with you, and carry a bottle of water so that you are sure that you're taken care of in that sense. So that is something that you should do. Ensure that you wear loose clothing so that it's easy to give injections, because the injection is usually given on your arm. Okay, so ensure that you take care of what you wear. I think what is most important is if you are suffering from any chronic disease, right? So if you are taking sugar medicines or you're taking blood pressure medicine or anything, right? Any regular drugs that you are taking under the advice of a doctor, ensure that you take the medicine as prescribed. So if you are supposed to take the medication in the morning, so take it as prescribed. Do not stop any medication. All right, that is very, very important, because that I have seen a lot of people who just do not take their medicines for a day or two. Please don't do that. Please take your medications. It's perfectly all right for you to do that. Also, now important is I have seen a lot of people who who have unfortunately suffered from COVID-19 in the past 8 to 10 weeks, right, in the second wave of COVID-19, and it's good to know that they have recovered well, and now is the time that they are thinking of also getting themselves vaccinated, right? So there are certain directives which are very clearly stated, and we have to follow them, right? So if you have suffered from COVID-19, from the day of your recovery, you need to wait for 12 weeks before you take your vaccination. Okay, why is this? Because when you have gone through the COVID-19 infection and recovered, your body has the ability to generate natural immunity, which means natural antibodies. So you have enough antibodies that you have generated to protect you from the infection. And hence, it's all right for you to wait for 12 weeks before you get your vaccination, so that you're protecting yourself for a much longer period from there on. Okay. The second is, if you have already taken your first dose and unfortunately you suffered from COVID, then you have to still wait from the day of recovery 12 weeks before you take your second dose. All right. So it's important that we remember this and take our vaccinations in the right manner by this wait period. It's important for all of us to know that see, we are talking a lot about vaccines, but it is important for us to understand that our body has the ability to fight any kind of infection. Most of us have that. We have a strong immune system, and we are able to fight in most cases against any infection that is around us, right? And it is important that we develop this natural capacity that our body has. There is no way that we can only rely on one form of protection, right? So we have to go back to our basics and understand that healthy living is the basis of everything. Okay, it doesn't take away. Vaccinations availability, good medication availability are all there, right? And they will only help us, but that must not take away our attention from the fact that we have to follow healthy living and good lifestyle, because that is the first and the foremost thing that is going to help us to be prepared for any infection, let alone COVID-19, right? Now, what are these things? And we go back to our basics again. And sometimes, I keep saying this quite a lot during our webinars, but it is important that we remember this and take care of this on a regular basis, right? What is the first and the foremost thing about healthy living? It is our diet, right? What we eat definitely defines and governs a lot of how our immune system is. So ensure that you have a diet which is well balanced. You have enough fruits and vegetables in your diet. You have enough nuts in your diet. Your diet is high on all minerals, right? So ensure that you have a mix of nuts every day, you have a mix of fruits every day, you have enough protein according to your body weight on a daily basis. Ensure you have moderate fat and carb content in your diet. So ensure that you are aware of what goes in your diet, right? I think that is really, really important for all of us over a long period of time to work and make the most of a healthy living, right? So ensure that you focus on what goes on a daily basis in your diet. Okay. The second important thing is definitely with diet, we always speak about exercise, right? I think exercise is extremely important. Um, we tend to not get time, or because of the lockdown situation, we are not able to step out. So a lot of people have issues with how exercise can be. But I think it's important that within your house, it is absolutely possible for you to pace around in the house, at least for a little while. The simplest advice that I give to all my patients is that after every meal, after everything that you eat or drink, it's important that you pace around for at least 10 minutes, right? Even with your 3 large meals in a day, you will be able to easily pace around about 30 minutes, right? And that's the simplest thing that you can do in this current scenario where it is difficult to find space or time with everything which is going around in the current pandemic situation, right? So ensure that you put in effort to do exercise on a regular basis. Now, exercise can be of different, can be different, right? It need not be that I'm just walking. A lot of people like yoga, people like Pilates, people do strength training, stretching, pranayam. All of these plus minus, can be incorporated to ensure that you lead a active lifestyle, right? So that's very, very important. I think the next thing that we talk about healthy living is definitely water intake, right? Water, our body it has more water, earth has more water than land. So we know that water is very, very important. So ensure that you drink adequate water, right? Do not wait for your body to give you a signal that you're thirsty. Most probably by the time that you wait for body to tell you that you're thirsty, it's actually too late. So ensure that you're having a rule that I tell, and it is easy to again follow, is a glass of water an hour is absolutely a good dictum to have. All your waking hours, if you even have 1 glass of water every hour, it will come up to about 2.5-3 liters, right? So that it will take care of your basic water intake needs. Okay, so ensure that you're drinking enough water. I think the next thing, and very, very important, that I keep talking about to everyone is enough sunlight exposure. Because we have been indoors most of the time, what I have seen is that a lot of people have vitamin D deficiency. Vitamin D is one of our very, very important immune boosters, and it pumps you up. It works at multiple levels to ensure that your immune cells are working well. So if vitamin D is not there, it does affect us. Okay. And because it's been a lockdown phase in the pandemic, a lot of us are actually not getting enough sunlight. So ensure that you make it a point that you get that 30-40 minutes of sunlight every single day. Okay. So be it in your balcony, be it near your window, if you have a terrace, whatever works for you, but try to get at least 30 to 40 minutes of sunlight every single day. Okay. The next important thing that I keep talking about, and I'm also guilty of, maybe not following it as much, is getting adequate, good quality sleep, right? I think sleep is very important. Sleep is a time when most of our bodily functions, are geared up to ensure that our waking hours are better. Okay, so sleep, a good sleep takes care of a lot of other things in the waking hours. So try and ensure that you are getting good sleep. If you have issues with sleep, talk to a doctor about it. There could be multiple reasons why sleep is affected. So ensure that you get a good night's sleep, at least say 6 to 8 hours, as much as is possible for you in a rested state. Okay. I think the last thing, and for me, I think it is of paramount importance, is how we take care of our mental health and our stress levels. I think COVID-19 has brought in a lot of mental health issues. People who are anxious, worried, we are depressed at times, we are feeling guilty, a sense of hopelessness sometimes, um, a lack of control, the uncertainty of a lot of things which is around us is making us feel extremely edgy and anxious. And this can kind of, what happens in our mental health to a large extent affects our physical health also. So I think it's very important that we work on our mental health also. Find out 15 minutes in your regular day-to-day schedule to take care of, doing something which is happy, making you feel great, right? So try to put that effort so that over a period of time, your body learns, your mind learns to be more calmer, right? So these are the things. Let us understand that well-being and a healthy living is the basis of everything, right? It is important that we do this on a regular basis and forever, of course, with vaccination, with preventive measures, with COVID appropriate behavior, right? This is how we are going to protect ourselves, our loved ones, our larger community, so that over a period of time we are able to fight the infection best, right? So that is the premise behind how we can take care of the current situation. Okay, now getting back to vaccinations, I think we spoke a lot about when we can take the vaccine and when we cannot take the vaccine, but I think it's important for us to understand that with healthy living, a lot of people still feel that there are few things that they can or cannot do. There's a question which says, how about smoking and drinking after vaccination? um, uh, you know uh, I can only tell you that the best thing would be to avoid smoking and drinking, because it doesn't help you in the long run. However, vaccination by itself is not going to affect any of these, or these will not affect the way the vaccines work. But I think over a long term, people who are chronic smokers, or people who use alcohol regularly, they tend to have an immune system which is poorer and less functioning, and they over a period of time may not be able to have the degree of response to or their ability to respond to any kind of infection or germ that is coming their way. So though there is no correlation, and you can definitely go ahead and get yourself vaccinated, but my humble request to you and my suggestion would be that think of ways in which you can call it quits, stop smoking and drinking. It will only do you well in the long run, right? People who have been chronic smokers have known to show a poorer outcome when fighting the COVID-19 infection as well. We all know that COVID-19 is primarily respiratory illness, where there is increased viscosity of the blood as well, and there is increased tendency of clot formation, and all of these things are definitely poorly affected by smoking. So my ardent request to you would be that you should stop smoking, if possible, cut down on your drinking and stop it completely. That would be the best thing that you can do, or the best gift that you can give for yourself, for your health. Okay, and also for your near and dear ones as well. So try to do it, but definitely go get vaccinated. There is no correlation between smoking and drinking and vaccination. So please go ahead and get yourself vaccinated. All right. So coming back to understanding the nuances of vaccination itself, right? A lot of people are worried about the side effects of post-vaccination, right? What can happen in the post-vaccinations? We spoke about at the time of vaccines, right? So you went there, you were on time, and you got yourself vaccinated, fantastic, all of that, and then you get back home. Now, what are those things that can happen? What are some of those common side effects that can happen, right? Now, because this is a intramuscular injection which is given on the arm, a lot of people, and this is very common, is that there is injection site tenderness. What do we mean by that? That there is basically pain, swelling, and discomfort at the site of injection, right? That's the most common thing that can happen to people who have gotten injected, right? The other thing that happens is definitely a tiredness, malaise, it's a kind of a rundown feeling, right? Like, because most vaccines, basically what the vaccine does is, in a controlled manner, we have given the either the germ or a part of the germ in that sense, right? In layman's language. So naturally, people who people would have a mild reaction to it. Okay. So apart from the pain and tenderness at the injection site, there could be tiredness, fatigue, rundown feeling. Some people do develop fever. Others can also have mild cold and cough. But what has been seen is that most of these symptoms are very transient. 48 to 72 hours max is what they last, and then they get better. Okay, so most of the time there is uh, uh, not much serious side effects, and people definitely are back to their regular functioning in a day's time, most of the time, right? Now it is important for us to understand that this is true with any vaccine. If you remember, if you have children at home, or if you have uh, uh, if you've seen anybody who has gotten vaccinated, in children especially, they all get fever after vaccination. It's a similar principle, that you would also have mild reactions post the vaccination, but then it gets better in 48 to 72 hours, as I mentioned, right? However, there are few certain known serious, very rare, but serious side effect that has been that has come up, is something called as thromboembolic phenomenon, which means the increased tendency of forming clots. Okay, now this is something that has been seen in very few patients. Okay, and it is sad that something like this happened post vaccination. But let us understand that thromboembolic phenomenon is actually something that happens with the COVID-19 infection, right? If you know, and if you know any near and dear ones who have suffered from COVID in the recent past, you would know that many of them had to take medications such as anticoagulants, which will help in making the blood thinner, so that they get, over a period of time, they don't have the tendency to form clots, right? Now the thromboembolic phenomenon, because the COVID-19 infection is very high, the risk is very high there, as compared to the risk of it happening because of the vaccine. It's very low with the vaccine. So definitely, though this is a very rare side effect, my ardent request for everybody is, please do go ahead and get yourself vaccinated. In most cases, you will have no issues and you'll get better with very mild side effects, right? It has also been seen that people who were vaccinated uh, had lesser or very milder form of illness as compared to people who were not vaccinated. So it definitely helps in the long run. Of course, there are unfortunate incidences, I think, which is out of the bell curve. And I feel sad that when I say that, yes, there are unfortunate instances, but if we had to take a statistical analysis, it seems that the vaccines have definitely helped in the long run to protect people against the infection or the severity of illness because of the infection, right? So that is important for us to understand. Okay. Now, of course, there are a lot of myths going around. I think and it's obvious, right? We are, because this is something that is new, and because it is something that we don't know about, naturally we tend to have misconceptions. We perceive things, people may talk about something, and there are all these doubts, right? I think I would want to dissipate a few of them. Okay, there is a definite misconception that the vaccines can lead to infertility or erectile dysfunction in men. I think this is a huge myth. There is no basis behind it, where it has come from. So please do not worry about this. Please go ahead and get yourself vaccinated. This is a big myth, and it is only making people scared and not going ahead for what is right for them, so please go ahead and get yourself vaccinated. I think there is also a lot big myth about, vaccines can alter our DNA, that suddenly I'm going to become uh, something different. I keep joking that if that were the case and the amount of vaccines that we have gotten since childhood, we should look very different today. But that is not the case, right? See, these vaccines, um, uh, you can't just alter a DNA, right? We'll have to there'll be a new species that would come out if that were the case, right? All these vaccines are either the dead attenuated vaccines, or it is the mRNA type of vaccine where there is a messenger. It's like a template which is injected, and looking at the template, there is certain the protein is formed, which is like the spike protein of the coronavirus, and against it is what the antibody response forms, right? So it's more like a template of a specific spike protein which is injected, right? So it is in no way related to our DNA, and it is no way going to alter our DNA. So please do not fall for such myths. It is absolutely wrong, and it will only scare people around us into, and not let them do what is right for them, right? So please do not fall for this. It doesn't, these vaccines are not known to cause any alteration in DNA. There was another myth which was running around. There are severe side effects because of it, which is not true. Most people will have very simple side effects, as I mentioned, about pain and mild fevers, or headaches, or simple flu-like symptoms, right? But nothing more than that. There is, this anaphylactic kind of reactions usually do not happen unless the person has a history of severe allergic reactions, which I mentioned to you. And if you have that kind of history, it's a good idea for you to first go ahead and talk to your treating physician before you take the vaccine itself, right? But it's not that the vaccine causes any severe side effects at that. Okay. We spoke about infertility already. I think, it's important that a lot of people say that, oh, I have already got the infection, why do I need to take the vaccine, right? Because I already have the antibodies. And that's true. You have the antibodies, which is protecting you. But the larger good that you would be doing by taking the vaccine is you will be helping in building what we call as herd immunity. So yes, if you have if you have recovered from COVID-19, your body's innate immunity is fantastic and it will protect you. And I usually tell people that it is best to have our natural immunity. But in the current circumstances where the pandemic has led to such a big devastation, sometimes we cannot wait for everybody to get infected and develop innate immunity. That would take a long time. And in that process, we may actually lose a lot of our beloved ones, especially those who are in the highly vulnerable age group, right? And hence the reason that vaccination is advocated. But of course, and that's the reason why, even if you have been infected, it's a good idea for you to wait for those 12 weeks and then go ahead and get yourself vaccinated. I think that's important, right? People also say that, I think that's also somewhere that we have seen in the West as well, that once we have the vaccination, we do not need to wear the mask. My take on this is, unless we have reached a certain number of people who are immune. So immunity can be developed, as we mentioned, from the natural immunity, that say I got the infection and then I have now developed my antibodies, or I took the vaccination and then I developed. But for we all need to reach a necessary large population who would have those antibodies for us to be able to say that it doesn't require us to follow COVID appropriate behavior. So India is such a large country. We have so many of us, right? So naturally, it is going to take time. And until such time that a large population is covered, either by vaccinations or by development of natural immunity, we will have to necessarily follow COVID appropriate behavior, right? So we will have to ensure that we are masking up, we are following hand hygiene, we are following physical distancing. I think it is important at a larger community level, that we follow this. You see, at an individual level might be different from what we are going to do for everybody around us, right? So we have to also think at a larger level and not just be thinking about ourselves. So hence the reason that I advocate that even though you have taken your vaccines, you are protected, and that's fantastic, and congratulations for that. You need to still follow COVID appropriate behavior until such time that there are enough number of people who have developed immunity in either form, either being through vaccinations or through the infection itself. Okay, so important that we remember this. Okay, great. So I'm just looking at if we have any questions. Just a moment. I'm looking at the time as well. So give me a moment. Yeah. So one more thing about vaccinations. I think there's a myth, like young people especially, have spoken to that. I don't have any illnesses. I'm not a diabetic. I'm not a hypertensive. I don't have any chronic illnesses. I keep good health. I've never had any severe. I'm not at a risk of any complications. So why do I need to take the vaccine? I think well, that is a very genuine question, and it's good that this question has been asked. But regardless of any risk, as I said, right, I think see, when we are out, there is always a risk of getting the infection and spreading it to others, right? So even though I have a strong immune system and I'm able to fight it, I might still be somebody who would be spreading that infection to other people who do not have as strong immune system as I may have, right? And that inadvertent spread can lead to other people suffering. And the reason why I advocate that everybody should get vaccinated, whoever is eligible should get vaccinated over a period of time, because most productive people would in the prime, between 18 and 45, this age group, the young adult population, we know that most of them would have good immune system and they will be able to fight the infection well. But because we do not know how we would be carrying it to others, is the reason why it is recommended that everybody gets themselves vaccinated. Okay. In the second wave, we have seen that a lot more younger people have suffered, and a lot more younger people who even though they did not have any other comorbidities or no other chronic diseases or risk factors, they still suffered from moderate or even moderate to severe form of illness. And one of the things that was said is that definitely that vaccination at some level had protected those who were fortunate enough to get it. And also, I think the mutation within the virus has led to infection spreading to the younger individuals at a much faster rate. Okay, so the second wave has kind of taught us that this infection can, because of the different strains that are coming of the COVID-19 virus, it is important that we cannot lose our guard, right? We can't let it down. We can't let down our guards. So it's important that we follow COVID appropriate behavior, take our vaccination in the background of a healthy living. Okay. So these are some of the few myths that I have heard. But if you have any other questions or any other myths or anything that you would want to clarify, I think it's a good idea. One of the questions that very commonly is asked about myths is, I'm going through my periods. I have my menstrual cycle right now. Can I go ahead and take the vaccination? Please understand that menstruation is something that happens on a regular monthly basis, right? It is no way a reason for you to not get vaccinated. Please go ahead, get yourself vaccinated as and when your time comes. If your schedule comes at a day when you are menstruating, it will not affect your immune system. It will not reduce your ability to, develop your immune response as after getting vaccinated. So please go ahead and get yourself vaccinated, even in your menstrual period. It doesn't harm you in any way. Okay, so please go ahead and schedule it, because we do not know when everybody gets their chance, right? It's difficult, right? Now that it has been opened up by the government for everybody, so you will have to go and get yourself registered. currently, because the registration happens only via the government COVID app. Ensure that you get yourself registered, find out your nearest facility where vaccinations is available, and get yourself registered there, take an appointment, and go get yourself vaccinated. Do not fall for any false information. It is only going to make things difficult for everybody in the long run. All right. So just looking through if there are any more questions that are coming. Great. So I don't see any more questions coming in. So let me just consolidate everything that we spoke of today, right? It's important that we all get vaccinated. Everybody who is eligible for getting vaccinated, please ensure that you register yourself, book an appointment for getting vaccinations done, and get yourself vaccinated. Vaccinations will help in reducing morbidity, mortality. It reduces hospital stays, reduces the stress on the healthcare system, and above all, it helps us all to break the chain of transmission of illness. So vaccinations do help. But understand that even in the background always has to be of COVID appropriate behavior. When I say COVID appropriate behavior, it means ensuring that you're wearing your mask, ensuring that you're sanitizing your hand regularly, ensuring that you are in following physical distancing at all times. This must be followed in a background of a healthy living. Healthy living will only ensure that we are staying strong against any illnesses, let alone COVID-19 infection. So ensure that you do all of these, get yourself vaccinated, stay safe, stay healthy, and get vaccinated at the earliest. Take care. Bye-bye.
Download the MediBuddy app now. Subscribe to our YouTube channel for more updates.